another slide with something I absolutely enjoy and love. I can't imagine they put those slides together for any particular reason, right? You know, like just keep Alicia talking, right? All right, so some of you know I have a background in risk adjustment and HCC coding. Absolutely love it, which is not surprising because I love diagnosis coding, right? ICD-10, ICD-9, doesn't matter. Just let me play with all of it. Well, now there's a credential for risk adjustment coders called the CRC, and I was able to take that, which now I think it's about 2 months ago. It came out this year. So I sat down, took that credential. It's fabulous to have that credential. Well, we have a fantastic course if that's something that you're going to look into. I keep saying it's the wave of the future. You know, Medicare, this is how the reimbursement is based normally on the CPT codes, right? What you do to the patient. But with Medicare and the MA plans, it's not. It's the level of chronic illnesses that your patient has. So they're projecting, they're doing a risk assessment about how much they need to set aside for the future and keeping your patients healthy or maintaining their health. But this course teaches you all about risk adjustment and HCC, jam-packed full of fantastic information about diagnosis coding and that behind-the-scenes stuff. Now, I was going to ask Joanne because she made a comment the other day, and I wanted to bring her in here. This is such a big deal that Joanne, as having a billing company, she was saying that the doctors were getting their checks for the year on the risk adjustment. Tell them what you found out, or what they came running to Joanne for help.
Yeah. No, that's where I spent most of my day today, going through how billers did not capture all the diagnosis codes that the physician actually wrote on the encounter form. And this one particular practice that deals with a pool of doctors of 200 lost. She was complaining $50,000 to $100,000 for her practice, and now I have to go in and audit and do a special alternative submission, and it's not claims, it's a special form that the IPA designed to fill in the blanks where the billers did not pick up those additional diagnosis codes. But everyone in this pool of primary cares have to do it in order for the doctors to get this bonus check. And of all the doctors in this hospital, only 2 out of 400 did it. And so it's like out of control and no one knows what they're doing. It's really huge. So, and it's the way of the future. You have to understand it because it is different than the medical necessity coding of what we're used to doing. And it's a whole different approach, but it is very important, and the doctors don't like losing money. So it was not a happy meeting today.
They need somebody that's actually trained in risk adjustment to be able to identify, because it is a completely different, I mean, it's like a sister to coding, but it's not. There's nuances that their guidelines are different and the rules are different. So again, if this is something that you're interested in, you like diagnostic coding, you like looking at a patient's record over a year period of time versus multiple patients, this might be a career for you, and there's a big demand for risk adjustment coders.
Very big.
And that's just now. In the next year, it's going to be even more.
But did you know that they had money linked to every diagnosis code? It's like I didn't realize that.
Yeah, now that's another thing that we'll explain if you get into the CRC. In the past, people thought it was only Medicare that did this, and now with the Affordable Care Act, every insurance is linked into risk adjustment, Medicaid, as well as all of your gold, silver, bronze, all of them have to do it. So again, I suspect that in the next 5 years we're going to see a huge shift to reimbursement being on diagnosis. So,
do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.